Good afternoon. I'm Karen Ignani, the CEO of EmblemHealth, and I want to, on behalf of Neil Tappel and LaborPress, welcome you to our Heroes of Labor event. This award program allows us to pause and recognize union leaders, men and women who are advocates, protectors, and people who make our city work. Given the times that we live in, given the pandemic, and given the life and death issues our honorees are dealing with every day, I can't think of anything more important. For a decade, we've been doing this event live from our Water Street headquarters, but the times demand flexibility, and this format has allowed us to honor people who are on the front lines, caring for the sick, the vulnerable, and in so doing so, putting themselves at risk. When I think of the definition of heroes, I think about people who put others first. I think about people who save us, who catch us, who are there for us, and whom we can lean on. Our honorees today are all of these things. They're healthcare heroes from the New York State Nurses Association, the Doctors Council, SEIU, Local 420, DC 37, AFSCME. My colleague Roberto will be introducing each of them. I know you will be as inspired as I am about their stories, and I'm not going to step on Roberto's introductions. For our part, we're honored to be able to participate in this event and bring these stories directly to you. Before Roberto introduces our winners, let me introduce Neil Tappel, our co-host. Neil is the publisher of LaborPress, which all of us read. He's given union men and women a crucial voice in the press and singularly lives the values we celebrate this afternoon. Neil, let me welcome you, my friend, to everyone, Neil Tappel.
Thank you, Karen. Today's event is very special. The doctors, nurses, support staff that work in hospitals and healthcare facilities are true heroes. They place their lives in jeopardy every day. COVID-19 caused an incredible amount of stress on these dedicated men and women charged with saving lives. The city is extremely fortunate to have the caliber of experienced and courageous union heads that we honor today. I admire all the honorees. They are great union leaders and dedicated public servants. LaborPress is very proud of the successful relationship we have developed with EmblemHealth through the years. We are particularly fortunate to work with Carmen Ignani, leader with vision for the future of healthcare services in our nation. And now it's my distinct pleasure to introduce Roberto Hermazabal, Assistant Vice President of Labor Sales at EmblemHealth. Take it away, Roberto.
Thank you, Neil. Thank you, Karen. And welcome, everyone, and thank you for joining. We appreciate all the hard work and dedication our union partners continue to uphold. We salute you for your service to keeping our city up and running every single day. We would like to begin the program by recognizing our first honoree. I would like to congratulate Judy Sheridan Gonzalez, President of the New York State Nurses Association. The New York State Nurses Association is a union of 4,200 frontline nurses standing together for strength at work, their practice, safe staffing, and healthcare for all. They are New York's largest union and professional association for registered nurses. As Judy is unable to join us today, her first and foremost wanted to thank EmblemHealth, LaborPress, and the healthcare community for honoring frontline workers. As a supporting comment, Judy has stated, we have unions so workers can have a voice. This week, she is using her voice by leading a nurses' strike in parts of New York. She has always been an advocate for workers' rights, as well as experience being a community advocate. Also, as the number of COVID-19 cases increases each day once again, Judy is thinking about and stands in solidarity with her frontline brothers and sisters and nurses who have gone above and beyond to deal with this incredible crisis, as a nation, as a world, as a state, and as a city. An injury to one is an injury to all, and we are fighting for our lives and our lives of our patients. Let's hope for a brighter tomorrow. Once again, thank you. Once again, Judy thanks EmblemHealth and LaborPress for caring about them and the work that they do. Next, I'd like to introduce and congratulate Dr. Frank Prashia, President of Doctors Council SEIU. Doctors Council SEIU unites doctors, patients, and communities they serve, advocating for quality, affordable health care for all. They are the frontline doctors from New York to Illinois, working together in hospitals, clinics, and in public health to achieve the highest standards in quality and working conditions, to win a safer staffing levels and empower doctors to do what they do best, caring for their patients. Let's play the video.
My name is Dr. Frank Prashia, and I am President of Doctors Council SEIU, the nation's oldest union for attending physicians and dentists and representing doctors in different states, including New York. I live in New York and work at New York City's health and hospital system, the largest public hospital system in the nation. I would like to thank both EmblemHealth and LaborPress for the nomination. I am honored to be here today on this panel with representatives from NYSDA and Local 420 of DC 37. I hope each of you and your families had a good and safe Thanksgiving. There are countless families throughout America, though, that could not, because they had lost loved ones since this all began. At Doctors Council SEIU, we represent frontline doctors. I thank each of the doctors and their colleagues for what they have done and are doing during this pandemic. It is beyond heroic. The whole patient care team, from doctors, PAs, nurses, to housekeepers, and so on, have been going above and beyond the heroic work that our doctors have done and continue to do with COVID-19, and future waves is inspiring and frightening at the same time. Our doctors, like so many other union members, keep New York going during this pandemic. The services we provide across the 5 boroughs of New York City and beyond are vital, numerous, and far-reaching, ranging from managing and responding to the coronavirus pandemic, to seeing patients in the New York City health and hospitals and clinics, in schools throughout the city through the DOHMH, to visiting patients at home through the Human Resources Administration, to providing services for those throughout the tri-state region with World Trade Center issues, to work in the medical examiner's office, to work in corrections, fire, police, sanitation, and TA, and also to work in correctional health services such as Rikers Island and the borough detention centers, as well as in the Ryan Nina Community Health Center, which is a FQHC safety net provider. At Doctors Council, we have been advocating for our members and patients and being there when they needed us. Some of what we did and are doing includes created a Doctors Council COVID-19 hotline available by phone, text, and email 24/7. We have been on the phone in highly emotional situations and being supportive. We are helping our doctors, be it one-to-one, by department, or by whole facilities and hospitals. Issues included getting enough PPE and N95 masks, obtaining leave for testing positive, obtaining childcare so as to be able to go to work, obtaining lodging for fear of bringing COVID home, testing for employees, coordinating with administration, chairs, supervisors, and human resources, etc. People are calling these days the so-called new normal, but there is nothing normal about being at a patient's bedside who is not allowed any family members and looking into that patient's eyes through your goggles over your N95 mask and holding their hand through your gloved hands as they die. There is nothing normal about an anesthesiologist being sprayed upon during an intubation procedure of a COVID-positive patient. There is nothing normal with an ER doctor dealing with too many seriously infected patients, or an ICU critical care doctor wondering if there are enough beds, meds, even ventilators for their patients. This has been worse than AIDS, H1N1, or even Ebola. This is not normal. In my 30 years as a physician, 20 years as an active member of Doctors Council SEIU, and 7 years as president, I had never seen anything like this. We should have been better prepared. That is why our collective advocacy is so important. Healthcare is not to be funded like a doc in the box, giving out Band-Aids and sending people home. Healthcare should be funded like the military, for casualties that rise easily to frightful extremes in both. and for they will become increasingly more common. Our members have been working hard to get this message out about COVID-19 by speaking to community members, to elected officials, and to the media, such as on 60 Minutes. As to advocacy, on a federal level, we, along with our international, have been calling on the U.S. Senate and House of Representatives to use the full resources of the federal government and the Defense Production Act to make and get to frontline workers the needed PPE, including N95 masks, as well as ventilators for patients. The supply chain and distribution methodology for PPE should also be improved. We call on the CDC to have real guidelines for infectious disease cases and not change the bar based on politics or short supply. We pushed for testing for all workers and the public as well, and also supporting social distancing and mask wearing. On the state level, we similarly called on the governor to use all state power to produce PPE and ventilators, as well as to have the state DOH also have consistent scientific guidelines. At the city level, we have supported the city council legislation to protect healthcare workers who speak out on health and safety issues, as well as a proper protocol and review of contracts for purchasing PPE. We fought against efforts to lay off 22,000 city employees that would cost jobs and lessen services, including healthcare. We and our members have done email, letters, and phone call advocacy on the federal and state levels. Frontline healthcare workers, such as our doctors, deserve hazard pay for all that they have done and continue to do with the pandemic and potential future waves. We want all patients to have access to quality care, and especially the Black and Brown community so disproportionately affected by COVID-19. We believe the vaccine should first go to frontline healthcare workers and those in vulnerable populations, such as in nursing homes, the elderly, and those with underlying comorbidities, who may be more seriously impacted with the coronavirus. We have worked with our employers, hospitals, and health systems and hope also to continue the heightened degree of communication and collaboration that has developed during this time. We believe such work will be essential to addressing issues that continue to come up during the COVID-19 pandemic, as well as figuring out the best way forward for us all. Please wear a mask, social distance, wash your hands, and stay safe. Thank you.
That was a very powerful and important message. Congratulations, Dr. Frank. And at this point, we'd like to welcome you to say a few words.
Thank you very much. I want to thank both EmblemHealth and LaborPress for the honor to be here with these two other individuals. Also, I do accept this for all our members and for all the workers in the city of New York and beyond that do what they must. Like many people, they're called heroes, but no one wants to receive a Purple Heart. We're doing what we're supposed to do. We're doing what's right. We're serving the public. Thank you.
Thank you, Frank. And last, but certainly not least, I'd like to introduce and congratulate Carmen Charles, President of Local 20 DC 37 ASME. The Local 420 DC 37 ASME members work in a variety of different job titles and at different levels, including biomedical equipment technician, respiratory therapy technicians, dietary aides, elevator operators, housekeeping aides, just to name a few. Let's play the video.
Hello, my name is Carmen Charles. I am the president of Local 420, District Council 37 ASME. I represent employees within the health and hospital healthcare system in New York City. I would like to thank EmblemHealth and Mr. Neil Tappel from LaborPress for this prestigious award. I also want to congratulate my peers, Dr. Frank Portia and Judy Sheridan. COVID-19 has been very challenging as a labor leader in communicating with my members because not only am I forced to be a little bit more careful, but it hinders my communication with the members, and that we can't have membership meetings the way we are used to doing it. We have to think about social distancing, we have to wear a mask, and it is quite frustrating, not only for the leaders of the union, but also for the members, because I like to have one-on-one communication. Um, and so, in the back of my mind, I always have to think about how I'm approaching a member rather than just walking up and talking to a person. And so, that has been the biggest challenge for me as the president of my local.
Congratulations, Carmen. At this point, we'd like to welcome you to say a few words.
Thank you so much. Again, it is my pleasure to be here. I am honored. I want to say a special thank you to Neil Tapel, whom I've known for many, many years when I first came into unionism, and EmblemHealth, Dr. Frank. I'm honored to be in your presence along with Judy from the Neisner. And in saying a few words, I want to personally thank not only the local 420 member, but every healthcare worker that have sacrificed, many of whom have sacrificed with their lives. And so I want to take this opportunity to say thank you, thank you, thank you. And even though you may not get the recognition that you deserve, we know that you are making the ultimate sacrifice. And so there aren't words enough or no amount of money that we can give to you to say job well done. And in closing, I want to say to the federal government, please pass the HEROES Act. Our members deserve it. They have put their lives on the line, and this is how to repay them. We can't pay them, but to show our gratitude. So I'm encouraging my colleagues, I'm encouraging every person who will see this video to please make phone calls to your legislators and encourage them to please, please, people are hurting, people are dying, and we need to make sure that we get the message out there that this COVID-19 is not a hoax. Enough people, one too many people have died for us to not take it seriously. So thank you again, EmblemHealth. Thank you, LaborPress, and to all of my colleagues. I appreciate you so much that you will never know how much. And if I don't get a chance to see you again, have a very happy, wonderful holiday.
Thank you, Carmen. I would like to thank everyone for attending and give a special congratulations to all our honorees and their accomplishments. I must say that I'm extremely proud to be part of an organization that truly partners with our New York labor unions. Again, thank you for your time, and please stay safe. At this time, I would like to bring back Karen to introduce our guest speaker.
Thank you, Roberto, to Carmen and Frank for your moving words. Thank you so much, and thank you for all that you and your members do. I want to come behind Carmen and Frank. Both of them advocated for federal action. There is no more important time, as Carmen just indicated, and I want to join full force and support that. And I know Neil feels the same way. Also, I think, Frank, you made such important comments about wearing masks and things we all know intrinsically, but it was great to have a physician remind all of us based on what you're seeing. So to both of you and to Judy, we thank all of you for all of your work, and you truly are inspirational heroes. I want to bridge now to Attorney General Leticia James. She wasn't able to be with us this afternoon, but was kind enough to shoot a video, which we're so excited about. She is indefatigable, is a wonderful defender of New York, labor rights, and the right thing to do. So with that, please, I want to welcome Attorney General Leticia James.
I want to thank EmblemHealth and LaborPress for recognizing the outstanding heroes of labor at this 9th annual award ceremony. You understand that New York City's union workers are the backbone of our economy, the strength of the middle class and working families, and the moral conscience of our city and state. Many don't know this, but I spent many years as a member of the UAW, and it is then that I understood how unions are critical to our communities. I think we can all agree that in times like this, your hard work, sacrifices, and voices are more critical than ever. And whether you're being honored as first responding firefighters or EMT professionals who have rushed into the eye of the COVID-19 storm to rescue the suffering, or as a healthcare worker who has risked it all to bring comfort and healing to the afflicted, you embody the highest values of Americans' labor movement: equity, equality, courage, community service, civic engagement, and solidarity. The fact is, the labor movement has helped to shape and build the America we know today. In the last 4 years, we have seen every possible attempt to tear us apart, to pit us against each other, and to take back the gains we have fought so hard to achieve. But each time they have come at us, we have stood together and resisted. Because we know that when we stand together, when we fight together, we win. I am proud to call you allies in the fight for justice, because there are so many in the great state of New York this very night whose rights and freedom remain under attack. This includes workers who continue to be mistreated and whose protections are being stripped away. It includes workers who continue to face opposition to unionize when they have had enough of lower than standard wages and unsafe working conditions. We know that our communities are only as strong as our unions. Unions have given so many millions the chance to work their way out of poverty into the middle class. And unions don't just benefit their members. They fight for policies and laws that benefit all Americans. They strengthen democracy by amplifying the voice of freedom and fairness. They promote equity by reducing wage gaps for women and people of color. For generations, it has been that way. And make no mistake, the labor movement will continue to play an indispensable role in safeguarding our rights. Unions exemplify the truth that we are stronger and at our best when we work together. And that is especially important in this moment. Too many hard-working New Yorkers face harassment, wage theft, and other forms of workplace exploitation. These factors, coupled with the federal government's new rules to roll back worker protections, have left workers more vulnerable than ever before. But just as we've seen setbacks in recent years, we've also seen powerful testaments to the true power of the working class. In addition to voting for a new president and vice president in the 2020 election, we saw the passage of a number of pro-labor initiatives in states across the country, from a rise in the minimum wage in Florida to the passage of paid family and medical leave in Colorado. In New York, we now have a state senate that we know will defend the rights of all union workers. In New York, we continue to have executive leadership that will keep pushing to reverse the injustices of the last 4 years. In New York City, we now have a minimum wage of $15 an hour that is already in effect, with other parts of the state set to follow suit. In New York, we now have an attorney general who you know will continue fighting for all of you. As a citizen, city council member, public advocate, now as attorney general, I've always stood with workers, demanding fair contracts, battling privatization, pushing for paid leave, championing the right to organize, and calling out corporations and agencies that wrong their workers. And during my first 2 years in office, we have taken on companies that intentionally cheat workers out of their fair wages, challenged the federal government's policies that put profits over people, and passed a new law to criminalize forms of workplace retaliation. You can count on me to always use the power of my office to safeguard your rights and hold bad actors accountable. My brothers and sisters, we are committed to seeking justice for working New Yorkers in every way we can. I want to again thank all of this year's honorees, EmblemHealth, LaborPress, and every union member and supporter in this state for standing together as one to unleash the power of the people, the power of justice, and the power of solidarity. Thank you.
I can't think of a more fitting end than
I want to thank EmblemHealth.
I can't think of a more fitting end but to end with Attorney General James, whose words are so inspiring, as are the words of our honorees. I hope that people emerge from this event with hope, with inspiration, and a real sense of thanks to our honorees, their members, and their colleagues doing the work that protects all of us and keeps us safe. Neil, on behalf of you and our team, if there's any other last word that you want to impart, I just want to thank you so much for your partnership. I always feel 10 feet tall when I end these events, but please, any last words?
Sure. You know, Karen, the two honorees or three honorees are actually very special. They're actually pioneers in the labor movement. And I knew Carmen as a radical organizing very early in her days. She and I were out there with signs and yelling and screaming. And she really created a tremendous ability to organize with DC 37 and ASME. And Frank, of course, started a union, which is incredible. It's an incredible story with Barry Leibowitz and really just Frank and Barry. So these two are very special in terms of the labor movement. In terms of EmblemHealth, I'm a user. I was a city worker, and I have to tell you, Karen, what you're doing is really incredible. The programs you're initiating are, and I know how tough it is to make changes, but you deserve, and the organization deserves tremendous credit. And thank you.
Thank you. Thank you, Neil. Roberto, thank you so much for being our Master of Ceremonies. Frank, Carmen, congratulations again. Thank you to all that are watching.